Oh, wonderful. Just in time. You'd be surprised how appreciative doctors can be when patients either turn up early or on time. My understanding is you're here for the cranial nerve exam today. Is that right? Yeah. Okay, so if you'd just like to take a seat opposite me, and then we'll be able to continue. Thank you. So just before we continue though, I've just got to ask a couple of questions just to gauge a bit more information. Okay? So just to start off then, can you just start by confirming your name and your postcode for me, please? Okay. Yep, just checking my file behind me. Okay, yep, so we've got the correct name and postcode on there. It's always a great start. It's never happened yet, but you never know. And secondly, can you confirm, have you had any changes in your taste or your smell in the up and coming days or weeks prior to booking your appointment with us? Okay. And thirdly, can you confirm whether you've had any physical trauma prior to booking your appointment with us? Okay. And fourthly, and most importantly, can you confirm that you give me consent to take out the cranial nerve exam on you today? Great. Once again, that's always a great start. So, in that instance then, we can begin with the examination. And just for your reference, my name's Dr. Chadwick. So, I'm going to be taking out a series of examinations ranging from testing your eye coordination to your sensory and sensation nerves. So, let's begin then. Now, first of all, I'm just going to be testing your vision through a series of examinations. So if you just sit nice and still for me, okay? Now first off, I'm going to be just looking into your pupils just to examine any anomalies there. Just check that it's all as it should be, okay? If you just look straight ahead for me, you can look right here if you wish. This won't hurt. Okay. In fact, before I go into the pupils, I just need to put on my gloves a second. Okay, so I'll begin with the pupil examination first then. Looking straight ahead for me, please. Okay. That's fine, you can blink. There's no problem with that. I'm just gently pulling down on it. Pulling down the pupil. Keeping your eyes in the same direction. done with this bit. And just look to the side for me, please. Thank you. And the other side now. Just looking off to the wall. You can have a look. Be poster if you so wish. Thank you. Okay. Right. So I'm happy with that then. Now unfortunately that's not it just yet. That's just the first examination. Now, I will just now need to test your eye coordination. Okay, so I will be shining quite a dim, mild light in your eye. Okay, so this won't damage your eyes, but I'm just going to inspect those now. Once again, just looking forward, just focus between my eyebrows for me. Just going to come a bit closer, in fact. Okay. Okay. I know it feels like you're at the opticians. Not quite, but nonetheless, you never know. You may be headed there. However, from what I can see, there's nothing wrong with your visual nerves as such just yet. However, I will give you a full synopsis at the end of the examination. Okay? Yeah. Okay. Again. Yeah, okay. So that's that step then. Just take these off as we go along, okay? Got my handy notebook with me. And I'll just quickly jot down my findings so far. Okay, tick. Right. That's fine. I was just reading if you had one before. Okay, so now we're still just going to be observing the optical nerves. So now what I need you to do is cover one eye for me. Okay? Just bear with me, I just need to take these off for a second. Okay. covering one eye. What I'm going to need you to do is follow the pen for me, okay? So doing that with the other eye, all I'm looking to do in this instance is just see that your optical reflexes are on point here. Okay. So just following the pen, that's all we're doing. All the while covering your one eye. Okay. Thank you. Oftentimes I was to get distracted by the pen, and I should be observing your reflexes. Okay. That's great. Okay. Wonderful. So once again I'm happy with that. And once again I'll take that off the list. Okay. Okay, so next I'm just going to test your sight range. I'm sure we've all seen one of these before. Okay, so first of all, before we read out any of the letters or numbers, I just need you to specify what colour or other colours you're able to see on this sheet of paper. Okay. Okay. And this one. Thank you. Yeah, so now I'm just going to test your sight range. Okay, so in fact I'll make this easier for you. Just be pointing that out for you, and if you just read to me what exactly it is you can see. Okay, great. So we'll begin with, okay, yeah, and the one following. Just read the entirety of the lines that I'm pointing out to you. Okay. That's great, you're doing wonderful. No pressure, this isn't a school environment or anything. Go to that one. Keep reading out the entirety of the line. Okay. Yeah, okay. The hardest one, so if you can just read the bottom one for me then, please. Yep. Okay. There we go. Yeah, that's fine. Just pop that back there. Okay. And once again, we'll take that off the list. I just like to be organised, you see. Okay. Right. once again, I want you to cover one eye for me, please. Yeah, that's wonderful. Now, I'm going to be moving my hands, and you're going to point with your other hand, your free hand, as to which one is moving. Okay? So, do that. In fact, yeah, that'll be better. You're covering your eye. Yep. Okay. 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 Yep. Thank you. And now if you cover the other eye as well, we'll test that as well. So, same situation applies. Just with your free hand, point out to me which of my fingers are moving. Okay? Yep. Okay. Great. Thank you. Thank you. Thank you. Okay. So yeah, I'm happy with that. Once again, before I forget, I'll just take that off. Okay. Doing well so far. So yeah, that's the visual examination done. So now I'm just going to go in with a brief touch examination. Okay? Just in case there was no physical trauma there. Now, for that, I'm going to be using this. It's a mimikaki brush. It's just a nice, fluffy, light and airy cotton bud. And what I want you to do is close your eyes for me and just tell me when you can feel that on your skin. So I'm going to be lightly touching it on your face, different pinpoints on your face, okay? And just say yes when you can feel that on your skin, okay? Wonderful. So closing your eyes now, just going to go ahead. So, okay. 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 Yep. And yeah, once again, keeping your eyes closed. Yeah, just keeping them closed for me, thank you. Yep. Thank you. Yep. Thank you. If at any point you can't feel that, just let me know. Yeah, more specifically, if you could tell me which location I'm touching you that with, because difficulty being, if you can't feel it, then you can't tell me that you can't feel the sensation. Yeah. Thank you. Okay. Thank you. Mm-hmm. Okay. Great. Hmm. Okay. Hmm. That's great. So if you just open your eyes for me momentarily. Yeah. Once again, I am happy with that. And now, with the same tool, I'm just going to flip that on its side. And if you could just tell me when you can feel a brief, sharp sensation. This isn't going to be painful, okay? So once again, just closing your eyes for me, please. Mm-hmm. Yep. Thank you. Okay. So, just say yes. Once again, when you feel a light, sharp stab. Okay? Thank you. Thank you. Mm-hmm. Mm-hmm. Yeah, so you just say yes every time you feel that. And now just specify the amount of times that I'm doing that. Mm-hmm. Mm-hmm. Okay. Thank you. And now, if you can just specify the location on your face as to where you can feel that, okay? Okay. Mm-hmm. There we go. So one last time then. Thank you. Yeah. So that's fine. Mm-hmm. Yeah, so now we're going to be testing your muscle reflexes, your nerves, okay, muscle gauge. So, for that, if you just bear with me, I'm just going to put on your gloves, okay? You can open your eyes, sorry. Don't need to keep them closed for this next step. Nice big gloves, blue. Okay. Bit tricky to put on sometimes, but there we go. Now, as I said, this next step, you're going to be testing your muscle gauge and strength, okay? Because if it's not up to par, then that can signify nerve damage or trauma in that instance. So, once again, sitting straight facing me, nice and relaxed, shoulders back. We're going to be focusing on the jaw, okay? So, I just need you to, clench them for me. Thank you. I'm just feeling those. Keep them clenched as hard as you can. Just that I just showed. Okay. Nice and tight. Okay. nice and tight. That's great, you're doing wonderful. Okay. Climbing them down. Climbing them down. Okay. Right, so now we're going to test the strength of your jaw, okay? So I want you to open it like this. Yeah? That's great. Now I'm going to be pushing up, pushing down on it, and I don't want you to let me close your jaw, okay? So, pushing down on that, okay? Pushing down. Wonderful. Just open your mouth again. Pushing down. Okay. That's great, thank you. Okay, so I'm happy with that then. I'm just going to be doing the shoulders. Oh, that's not necessary. Beyond the shoulders. So just relax the shoulders and then put them up as high as you can. And don't let me push them down, okay? Thank you. Yeah. The other one. Okay, and both together now. Wonderful. Yep. That's all fine as well. So we'll quickly brief over smell now. Okay. Just going to be testing your naval nerves. Now I know you did specify at the beginning of the appointment that you haven't experienced any change in smell. However, this is just protocol, okay? So, I've got a bottle here, and I just want you to smell it, and just tell me what scent you can smell, okay? I won't repeat this with numerous ones, because that's not what I'm concerned about in this instance. However, you just get a nice smell for that now. Okay? Yeah. It smells nice, doesn't it? Thank you. And if you could just tell me what smell you think that is? That's right. In fact, hopefully you didn't read the bottle, but nonetheless, I'll take your word in that instance. Okay. So, final instance of this examination then is going to be your auditory nerves, okay? So, I'm just going to come each end of you. I'm going to assess your hearing. So I'm going to need you to cover one ear at a time. I'm going to go either side of you. What I'm going to do is I'm going to relay some numbers fairly quietly and at certain distances, and you're going to tell me and relay the number back to me, or if you can't hear it, then also let me know. So I'm just going to come to this side of you first of all, okay? 76. Great, thank you. And sorry, just cover the other ear, please. Wonderful. 76. Yeah, that's great. 94. 27. 48. 12. 19. 112. 63. 62. 9. 11. 45. 3. 142. Okay, was that one a bit more difficult? That's fine. Not a problem. Yeah. Just going to come the other side now. And once again, just cover the other ear for me, please. And once again, just relay the numbers to me that you can hear me say. Okay? 29. 47. 12. 18. 176. 47. 18. 88. 1,000. 12. 102. 9. Okay. Yeah, that's great. Now, what I'm going to do, once again, testing your auditory ability. I'm just going to stand behind you. This time I don't need to cover your ears at all, but if you could just tell me on which direction you can hear the click. Okay. So I'm just going to come behind you now, okay? Thank you. So I just need you to tell me left or right, okay? Okay. once again, that's perfectly fine. Yeah. Let's pop that there. Right. Last step then. So far, so good. I'm just going to be going like that, away. Just tell me when you can no longer hear that. Okay? Yeah. So, this side then. Okay. Cute. I know it's a combination between a clap and a click. So that's the usual range as to what we would expect. So, just take off the notes then. However, that is you done. Okay? So if you just stay here for a moment, I'll just take everything off. And I'll relay that to the nurse. Okay? Just so that once again is on file. You did great, so I would advise to do this yearly, really, unless you, as I mentioned, have experienced any change to your auditory or sensory or muscle capacity. Yeah, or similarly, if you've experienced any physical trauma, then by all means I would recommend it shorter than a year. So, yeah, I was happy with the findings. I'll write up brief notes for the nurse to type up on the computer. However, that is your examination completed. Okay? Yeah. So there's nothing more that I can relate to you really, because I was perfectly happy with what I found in this instance. Okay? But yeah, you are perfectly, right to be concerned should you experience any differences like that. However, it can just be down to stress in some instances. That is a very common cause with a lot of these cases. Yeah. Well, I hope to see you again next time. Okay? Until then, have a good day.